You're okay. Well, good evening. My name's Bob Mason with the Medical Strategic Network, and again, would like to welcome you to our second preceptorship and pre-pro alumni webinar. And this evening, got a couple of guests that we're going to be talking to. One is Stan Shu, who many of you will remember. Stan's a pediatric neurologist at Loma Linda, and then Kristen Farthing. Kristen is a PA in Indianapolis, and Kristen is a preceptorship alum. And of course, Stan's been on our faculty for ever since we started the preceptorship in 2001. So, Stan, welcome. How are you doing tonight?
Oh, doing pretty good.
Yeah? Well, it's good to see you again. There's several things I wanted to talk to you about, Stan, just to get started. Healthcare is changing rapidly, and one of the things that's been significantly affected by some of those changes is just the amount of time that you can spend with a patient, both in the clinic and in the hospital, just because of the demands that you have. So as these changes take place, I was wondering if you could talk to us a little bit about how you've adjusted it to that. But maybe first start off, when you're in the hospital and you're rounding, what are some of the things, what are some of your objectives when you see patients on rounds?
Well, I have several objectives. The first is to understand what the patient's perceived needs are versus the actual needs from a medical point of view, but also understand how they're doing emotionally and spiritually with their illness. And that usually takes, multiple conversations.
So you're not only trying to touch on the medical side, but you're also you're trying to touch on the spiritual side as well. But you just don't have a whole lot of time to do that. So how do you sort of start off, and what do you try to cover and connect with?
Well, I usually start my rounds early morning. At our hospital, we're only allowed to round with a team from 9 to 12. So I'm usually there between 6:30 and 7, and I'll start talking to patients ahead of time. And this allows me to get into a little more in-depth conversations beforehand, and also leave little seeds and to bring out more ideas later on. Then I will see the patient during rounds, and then I'll see them again after rounds, usually at lunchtime or in the early afternoon. And then I'll swing by once more near the end of the day before I go home. So this allows me to bring up more and more questions and ideas to the patients as we go through the day.
So I hear you talking about going, seeing them several times during the day. Have you found is that common? Do your colleagues see them that many times?
I think most of them only see them once during the day. It's just that during rounds, we have to see 18 patients in 3 hours. You only have a few minutes per patient after a presentation from the team. So I find in 3 minutes I can't get a good conversation. So that's why I start and ask a leading question in the morning, and then we'll follow up with that question at lunchtime, then another question in late afternoon, and that allows us to build a relationship.
Yeah, so give us an example of one of the, you said you asked one and then you do a follow-up question or whatever. Give us an example of some of the questions you asked.
So for example, a patient that I saw yesterday, when I saw the patient in the early morning, we went by and asked them how they were doing and how has this been difficult for them. And the woman said, I'm not really sure. Her child had been abused. And she said, I wasn't sure what had happened, but she was scared and frightened. And I asked her, where did she get her strength from? And she said, I get it from many different areas. I get it from friends, work, God. And then I asked her, well, has God, made a big difference in your life? And she said, I'm not sure. But, and so I asked her, well, maybe we can talk about that a little bit. Then at lunchtime, we followed up and said, So what are you thinking about how you're relating with God? And he said, I'm really angry with God right now. Why did this happen to my child? And,
Okay.
and so we just kept on with the conversation bit by bit.
So these repeated visits, I mean, several times a day, it sounds like from what you're saying that makes a difference.
Well, I think it shows the patient that I care not just about the medical issue, but I really want to make sure, see how they're doing with the rest of themselves, and see how they're doing, how they're coping. And as we go through the day in the hospital, more and more information comes up. So I want to make sure, see how they're coping with it. And I think the patients notice that I really do care about how they're feeling, what's going on with them, not just delivering information.
Okay,
That
wow.
helps the relationship.
Now that recently you and I were talking, and you were telling me about a patient, and maybe was there a dad or somebody else that was sort of on the side and just not real interactive with you?
Yeah, we had one gentleman, um, and when I talked to him in the morning, he was very quiet, didn't interact much. Um, Talked to him again at lunchtime, and again, not very much feedback. But the third time I came by, he began to open up, and he said, Doc, you keep on asking me how I'm doing, and to be honest, I'm doing terrible. And then he started sharing a little bit more, just about how he was feeling and how he was coping with the child's problems. But it took several questions and being very proactive before he finally started opening up.
Yeah, and it almost sounds like as you're talking that these repeated visits, one of the things that happens is that there seems to be an increased level of trust that begins to kick in.
Yeah, I think so. I had one of the patients who's seen one of my partners for about a year, and she said, I've seen you more in the last 2 days than I saw the other person for a year, because I had seen them literally 6 times in 2 days. My partner had seen them twice in a year. And so they felt more comfortable sharing and opening up, not just about the medical issues, but about their family and how the illness had affected the family. And then from there, how the spiritual side came into that.
Wow. Okay. And are there other non-medical issues or key things that you try to pick up on or try to even specifically ask about?
Well, since a lot of my patients have long-term problems, I ask a lot about worldview. Where did they come from? What's their purpose in life, or what do you think their child's purpose in life is? And of course, where they are going long-term. I think especially when you hit life-threatening issues, worldview becomes extremely important. Uh, we,
So go ahead, talk a little bit more about that.
so we had a patient that came in the hospital yesterday morning who had a limitation of care, and basically the child was supposed to die at home, and the mom just felt uncomfortable, so she called 911 when the child started having difficulties. And then as we came into the hospital, we talked about, what was the child's purpose in life, and the child was only 4 months old, and she said, well, is his purpose only to suffer? I said, no, it's more than just to suffer. And I asked her, well, what part of his life, have you enjoyed? And she talked about the joy of the pregnancy, joy of the birth, and joy during the first few months of life until the child's genetic disorder became very apparent. And so we talked about how much joy the child had brought in, and that she was from a Christian background, and we talked about where the child was going to go, and then she had a great peace knowing that he was going to be going into heaven. And so it was much easier to talk about those end-of-life issues, knowing what the mom's perception of life was.
Wow. But when you first started out that conversation with this lady, it sounded like the two of you were sort of had different perspectives.
They were
And
a little bit different to start.
so do you push your patients, so to speak, or do you challenge them in terms of what they tell you or what they seem to be thinking?
I think if what they're saying is logical, maybe I won't push them too much. But then if they're not logical, and I have a little bit of rapport, then I feel comfortable challenging them. We had a different family. The mom, outright said, "I'm an atheist. I do not believe there is a God." I said, "Oh, okay." And I said, "Well, what's going to happen to your child?" "Well, he's going to heaven." And I'm like, "Oh, but you said there's no such thing as God." And so the first time she said it, I just said that, left it alone. Then when I came back, talked to her about an hour later, we kind of touched upon it again. I said, wait, this is what you said last time, but it doesn't really make sense to me if you say that there's no God, your child's going to heaven. So we've been having this conversation for the last week, like twice a day.
Wow.
And then today, which is my last day on service, she's saying, no, there probably is a God, and God is here. But now she says, I'm really angry that there's a God for having this happen to my child. So
yeah.
we're making some progress there, but at least, I think I pushed her a little bit because what she was saying made no sense.
Yeah. Well, when you talk about pushing patients, when you talk about challenging them, what type of attitude do you have, and what type of attitude would the patient pick up from you, or the patient's family?
I'm really just trying to have them clarify it. And in her case, I just said, well, you say there's no such thing as God, but you say he's going to heaven. Can you explain how that works to me? Because I don't understand that.
Okay.
And we had this open conversation. So she got stuck. She just said, well, I can't explain it. So I said, well, then something has to give there because it doesn't make sense.
Yeah. So what I sort of hear you saying here, it's not so much that you're trying to pick a fight with them or get into a philosophical debate, but really you're just seeking to have a better understanding of where they're coming from and why they think the way they do.
Yeah, and it's really helpful because especially for people from different faiths, I mean, I find that a lot of people don't even know what they actually believe. And so when you start asking them, well, why do you believe this? They're like, well, I'm not sure. And so we say, okay, well, let's explore that. And fortunately, whatever faith it is, a lot of them have already done research. I probably know a little bit better than they do. But it's good to just start that way and then show them whether what they're thinking is logical or illogical.
One thing that sort of stuck in the back of my mind from something you said earlier, Stan, was I mean, I'm still, trying to wrap my mind around this idea of you seeing patients several times as compared to maybe other people in your field. You see them several times a day, and other people in your field only see them once a day. How does that square with not only being a physician, but being a father, being a spouse, being somebody who's involved in direct ministry with other students and residents? I mean, where do you find time to do all this?
Well, I look at it as patients are my ministry. And if I went into medicine because I'm here to serve my patients, be there as Jesus would be, then that's where I put my time and energy. So I may do fewer Bible studies or other groups, but then I'm doing Bible study with patients, discussing things with patients. And so instead of being involved with multiple things in church and different groups, I'm focusing primarily on addressing patients' issues, doing follow-up on spiritual conversations. I'll call people at home at night. So how's this going? What's happening here? So in many ways, my patients are, part of my larger Bible study groups in terms of meeting with them.
Yeah, I mean that's a great example, I think, of some of the things that we talk about all the time at the preceptorship, at the pre-pro programs, at METS conferences, and just that intentionality. And you said something earlier that I'd like to come back to. You talked about how your colleagues round at 9 typically, and you said you started typically when?
6:30 or 7, depending on how busy it is.
Okay.
Sometimes earlier.
Go ahead.
Well, it depends on how busy it is. Certain patients are dealing with lots of things, and they're very time intensive. So you could spend an hour with one family if they're going through a lot of issues.
Okay.
Like,
So that's probably a little bit of a sacrifice on your part, maybe not quite as much sleep, not an elaborate breakfast in the morning, but then at the same time, it's probably time that doesn't take away from anybody else but you?
that's correct. It just makes it, because during the teaching rounds, we're actually required only to do 3 hours. You can't spend more or you can spend more than that. So if you want to spend more than 3 hours with a patient, you have to do it on your own time.
Okay. Wow. And so that sort of gets back into that whole thing of this is your ministry, and rather than after work run out and do another Bible study or do some discipling then, you've sort of already got your time in for the day.
Yeah. Or
Wow.
you just fit it in through the day. Like sometimes I'll see patients at 6, meet with a resident or student at 7, then go back and see patients at 8.
Okay.
In during the morning.
Yeah. Well, thank you. That's really helpful, and I think most of you who are sort of in this network knows how to get in touch with Stan. If you don't, get in touch with me, and I'm sure Stan would be happy to interact with several of you via email or whatever, because I think it's a lot different. A lot of the people that we connected with them when they're in training. And now that many of them are out in practice, they have a different set of questions and a different set of issues that they're dealing with. And so Dr. Hsu could be a huge resource. So Stan, thank you. Thanks for being with us, and thanks for joining us. I want to shift attention to Kristen. Kristen, welcome.
Thanks, Bob.
So tell us just a little bit about yourself, about when you came to the preceptorship, what you're doing these days.
Sure. I actually came to the preceptorship back in 2009. It's hard to believe it was that long ago, when I was still a PA student. And since then, I've worked a few years in internal medicine, and now I recently started a job at a children's hospital in their cardiac surgery. So it's been really fun to put into practice everything I learned at the preceptorship and to see how impactful it can be.
Well, cool. And you've got a different name now.
I do. I got married 3 years ago.
Okay. Well, good. Good. I'm looking forward to meeting your husband, hopefully in a few weeks. And I still remember sitting in Westwood, I think it was, with you, and Diana and I having dinner together. I think it was California Pizza Kitchen or something like that back in the back. And so that was a fun summer. So probably, I'm hoping that I'm going to get to meet your husband in a few weeks. I'm going to be in Indianapolis. We're doing a conference there. So, Kristen, tell us, how did this conference in Indianapolis?
I've been dreaming about doing a conference in Indianapolis since the preceptorship. I remember talking with you in the car about it and how incredible it would be to bring the whole person care and the METS conference to Indy. But it was this year, I think actually last summer, that Helena Torres, another Butler grad, she's a pharmacist, contacted a bunch of people in Indianapolis and the surrounding states and said, hey, let's do this. The time is now. Let's get a conference together and really bring this area together.
Wow. And so, so when is the conference and where is it going to be?
Sure. It's March 27th and 28th. And it starts that Friday the 27th with registration about 5 and goes until evening on the Saturday. And it'll be at a local church, College Park Church, on the north side of Indianapolis.
Well, that's great, and we're excited about partnering with College Park Church. I think, from what I understand, we're privileged to be able to come alongside of them. They have a lot of healthcare professionals and students, and then there are a lot of alums. There are med schools there. There's Butler. There's pharmacy. There's nursing. And so it's going to be a lot of fun. So you've sort of been in on this from the beginning, and how God sort of brought all this together. And sometimes stepping out in leadership and initiating, sometimes it can be exciting, other times it can be faced with challenges. But what's God been teaching you as you've sort of been on the front end of leading in this way?
Absolutely. I think God has definitely been teaching me humility, as I'm a planner and would like it all to be organized right now. But also, He's just been renewing my passion as I tell other people about whole person care and invite them to the conference. It really sparks my passion and challenges me to be living it out every day at work. So I'm grateful for this opportunity to remember, reflect, and revisit.
Yeah. Wow. And you know, there's a lot of cool things going on in Indianapolis right now with churches and with Christians and with CMDA and other crew and other entities. How would you like, and how are you dreaming that Indy will be different as a result of this conference in the area around Indianapolis? How do you want God to show up, and how are you thinking He'll show up and make things different?
First, I think I'm excited to unify the believers who work in healthcare in this area, to encourage one another that you're not the only one out there who desires to use their faith to minister to patients. And second, I just hope that after the conference in a few years, that spiritual conversations and prayer will be commonplace in patients' rooms, and that many will come to know Christ through it.
Wow. Well, that's cool. If somebody's watching, they want to get more information, they want to register, how do they do that?
Absolutely. You can go to the Medical Strategic Network webpage, www.medsn.org. Is that right?
Yep, that's right.
And upcoming conferences, Indianapolis should be the first one. You can register there. Or if you have any questions, feel free to contact me or Helena. Bob definitely has our contact info. We'd be happy to talk with you about it.
Yep, very much so. And Kristen, how can we be praying for you? How can we be praying for the leadership team? How can we be praying for the conference?
Thank you. First of all, we're looking for someone who plays the piano to help lead worship. So if anyone listening is a pianist, let us know. Second, we're really praying for strategic connections around the Indianapolis medical community to help spread the word and get our message out. And also just that God would move mightily through the presenters at the conference, and that He'd be glorified through it all.
So, well, it sounds great, and I'm looking forward to seeing you and joining the rest of the team. I think it's about a little bit less than 5 weeks now.
Yeah.
And, from tonight. So thank you. Thanks for all your work. And so we're going to wrap things up with that. Stan, Shu, again, thanks for being with us. And Kristen, thanks for being with us. And thanks to our behind-the-scenes engineer and Hangouts producer, Kyle Stelzer, preceptorship alum from this past summer. So we're going to end it with that. And thanks so much. God bless you. Let us know how we can serve you.